Hi, I'm Abhay Gupta. I'm a board-certified plastic surgeon practicing in San Diego at Gupta Plastic Surgery. Welcome to the website. This is another video answer to commonly asked questions that I get from patients. One of the more commonly asked questions I get is the difference between liposuction, tummy tuck, mini tummy tuck. There's so many different procedures out there. Which one is the best for you? So I do get a lot of consultations for the abdominal area, and really what comes down to the best option for each particular patient is the characteristics or the quality of their tissues, the quality of their muscle layer in the abdomen. So the three main choices of reshaping in the abdomen area are liposuction, mini tummy tuck, or a full tummy tuck. And it depends on how much extra skin the patient has, how much extra fat they have, and importantly, how good their muscle tone is. So when we gain weight, the first thing to realize is skin is an elastic substance. So if you stretch skin, it will stretch. As you gain weight or as you're pregnant and the baby goes inside the uterus, the skin will stretch as the belly stretches. When you lose weight or after you deliver the baby, the skin will always want to come back to where it was. It wants to contract back to where it was. And that's the elasticity of it, similar to a waistband on an undergarment. After a certain period of time, if you stretch the skin too much or too frequently or too quickly, the skin will lose that elasticity and can stay relaxed, in which case you'll see some stretch marks and the skin will be sagging or hanging down. As well, at the same time, the muscles can be stretched or over-thinned from excess weight gain from the stretching involved with pregnancy, for example. And those can be also resulting effects on the muscle with permanent damage. So all of those are taken into consideration when we see a patient consultation for abdominal shaping to determine the best option. So for example, if somebody comes in and they have some extra fat on their abdomen, but they have very good muscle tone underneath with no weakening, or they've never been pregnant, or they haven't had a history of obesity, so the muscle tone is pretty good. And their skin tone is pretty good in that they don't have a lot of stretch marks or a lot of stretching. That patient would be a great candidate for liposuction because what we can do is we can remove all the extra fat that's in there. Once we do so, the skin will want to tighten or contract back down to the smaller frame inside, to the muscle, to the good muscle tone, and you'll see an improvement in overall shape or contour on that patient. If that same patient, however, has a lot of extra fat but also extra skin due to more weight gain, then the problem is once you remove the fat, the skin's not going to tighten as much and they'll be left with extra hanging skin on their belly. Or if they have stretch marks on their belly, for example, that stretch mark shows that the skin's been stretched too much and the elasticity is not very good. So after you suck out the fat, the skin won't contract back down and you'll actually make it look worse by doing liposuction. So in those patients, a much better option is doing a tummy tuck, where we remove the extra skin that's too lax or too saggy and remove the fat at the same time. So the question is, what's the difference between a mini tummy tuck and a full tummy tuck? That comes down to the quality of their muscle tissue. If they have good muscle tone with not weakening of the muscle, or what we call rectus diastasis, where the two six-pack muscles separate in the middle to form a gap, which can happen with weight gain or pregnancy, especially multiple times. If they don't have that and there's good muscle tone, then we can remove just the extra skin and the fat alone, and that's what a mini tummy tuck is. Generally, that can be done through a smaller incision, similar to a C-section scar that's hidden underneath the underwear line, and the extra skin is removed and tightened to make a much flatter belly. Usually that's done in the lower abdomen below the belly button. Very rarely is it necessary to go above the belly button for that kind of procedure. The full tummy tuck, however, involves a more extensive tightening of the belly, and that's for people who have extra skin, extra fat hanging, extra skin hanging, extra fat, but also poor muscle quality or poor muscle tone, where they have weakness of the abdominal muscles, so they get bulging or that rectus diastasis separation. In that case, liposuction or mini tummy tuck aren't going to fix the muscles, so therefore the patient will still have that bulge resulting from weak muscles. And the only option would be, or the best option would be, to do a full tummy tuck, where we remove the extra skin, we remove the fat, but more importantly, on the inside, we take those muscles and we suture them together and tighten that muscle layer on the inside to recreate that firm, rigid abdominal wall that also helps pull in the tissues from the sides to get a narrowing of the waistline. The full tummy tuck is done similar to a mini tummy tuck, but a little longer incision from hip to hip underneath the underwire line, so that we can reach all the way up top in the abdomen to tighten the muscles from top to bottom. Obviously, it has a little longer recovery time than a mini tummy tuck or liposuction, because tightening the muscles does involve a little bit more pain, usually about a 3 to 4 week recovery time from that surgery. So really, the best answer for what's the right option for you, whether it be liposuction, mini tummy tuck, or a full tummy tuck, comes down to what the quality of your tissues are like, what the quality of your skin is like, what the quality of your muscle is like, and how much fat there is. Many times it's a combination of the procedures to get the best result, but each case is individual, and that's why really it's a question that has to be answered after a full consultation with a board-certified plastic surgeon who can have a chance to fully assess your tissues and tell you the best options for them. Hopefully that helps. Please feel free to check out the other videos on our website at www.guptaplasticsurgery.com, and thanks very much for your time.